but we have a lot of content to cover today, so we will dive right in. So hello and welcome to today's session. This is the 2023 SOAR informational session for the Texas Balance of State Continuum of Care. My name is Hope Rogers, and I am the COC Performance Manager for Texas Homeless Network, and also serve as the SOAR local lead for the Texas Balance of State Continuum of Care. A couple of quick housekeeping items before we get into today's webinar. This session will be recorded and we posted to our YouTube channel. A copy of today's PowerPoint has been dropped in the chat, thanks to the lovely Craig, but will also be shared following the session by email, in addition to a link of the recording. I am joined today by our guest speakers, Sumitra and Lila, who are two truly wonderful humans who do lots of amazing work around SOAR. So I'm going to pass it over to Sumitra and then Lila to introduce themselves. And while they're doing that, we want to hear from you. So in the chat, please share your name, your community, and then respond to these two questions on screen, which are if anyone in your agency has been SOAR certified in the last 24 months, and if yes, is SOAR their primary function of their role? And with that, I will pass it over to Sumitra.
Great, thank you, Hope. Hi, everybody. Good afternoon. My name is Sumitra Pokato. I work at the Sam SOAR TA Center. So that's the national funded TA center that works with different states to help grow, implement, maintain, whatever it may be, their SOAR initiatives. I have been working with the state of Texas for approximately the last 2 years as being the TA center liaison, and very, very happy to be here presenting to you all today. Lila, you want to go next?
Yeah, hi, good afternoon, everyone. Thank you, Sumitra. So my name is Lila Ordonez. Can y'all hear me well?
Mm-hmm.
Okay, so good afternoon, everyone, and I'm glad to be here. I serve, I would say, different roles. So I work for Avenue 360 Health and Wellness here in Houston, and I am basically run the SOAR program for them, or with them. There's a team of 4 of us that work the SOAR program, and we have 2 case managers and navigator. I just like to give a little insight on what my role looks like daily. And so, so we complete about 6 applications a week, and so forth. So I've been in the field 26 years, but I've been working with SOAR for the last 9 years. So I say it like that because I can't believe how time flies. And I continue to learn and grow in SOAR, which is exciting. And I also serve and work with the Coalition for the Homeless here in the capacity of co-community lead. And I am always thankful to be guided by Sumitra. She is awesome at what she does. So again, excited to be here and looking forward to all the work that the Balance of State is going to be doing, and just super excited that we're finally spreading out throughout Texas. Thank you.
Thanks, y'all, and thanks for all the folks who are responding in the chat. We will go ahead and move on, but please continue to introduce yourselves in the chat so we know who's in the room. So from today's webinar, you can expect to learn a general overview of SOAR from the experts, including information about the SOAR model, its effectiveness, and how to get started with SOAR, as well as some information about why SOAR is a priority for the Texas Balance of State Continuum of Care and how SOAR can be used as a tool to improve both client outcomes as well as housing program outcomes. We will have a space for questions following the content that Sumitra and Lila are going to cover. And then we're also going to have space at the end following the content that I cover. But also please feel free to use the chat and the Q&A pod throughout the session, and we will make sure that we get to your questions. So with that, I will hand it over to Sumitra.
All right, great. Thank you, everybody. So as Hope stated, we just want to make sure that we are providing information about, with SOAR being one of the Balance of State priorities this year, we want to make sure that you all have the information that's needed to at least know what SOAR is, who the target population is and how it be helpful to the individuals that you all serve. We recognize that this is an area in a region that has been underserved or really where SOAR has been underutilized. And so we definitely want to make sure that you have the necessary knowledge that you need to know. So what I'm going to do is I'm going to start off a little bit broad in terms of just what SOAR is, and then we'll kind of narrow down a little bit as we go along. If you have questions, you can feel free to put them in the chat box. As Hope stated, we'd be glad to answer questions at the end. All right, next slide, please. Okay, so let's kind of kick off and talk about some basics just in terms of SOAR. Now, SOAR has been around in the state of Texas as a whole, for a while. So even if you yourself aren't SOAR trained or you don't know in depth about SOAR, you've probably at least heard of it and know that it's at least related to benefits. One of the main things that I like to make sure that people understand is that SOAR in and of itself is a model. It's a model in which caseworkers or whomever's doing the work, peers, lawyers, volunteers, interns, whoever, I'm just going to say caseworkers. It's a model in which caseworkers are trained to be able to put together complete quality disability applications for those that may be experiencing homelessness and or may be at risk of homelessness. So I just kind of want to, get that across that because they're like a direct funding stream for SOAR, there's not like a SOAR program or agency, but rather it's a model, it's a best practice. It's something that a caseworker would use to be able to assist this population. So as I stated, SOAR is targeted towards those who are either experiencing homelessness or maybe at risk of homelessness and who have a serious mental health condition, co-occurring substance use disorder, and or other physical disabilities. So again, being mindful that not just necessarily when we talk about SOAR and when we talk about eligibility, that it's not just necessarily looking at, okay, this person's experiencing homelessness, they're a good SOAR candidate, but it's this two-part, right? Experiencing homelessness, but also has serious impairments related to their mental health, physical health, or co-occurring substance use disorder. So SOAR is a national model. You'll find it's been sponsored by SAMHSA in collaboration with Social Security since 2005, and you can find different implementations of it in all 50 states and Washington, D.C. SOAR training is standardized, but in terms of the way that it is implemented, in terms of the amount of resources that it has, is going to look differently depending where you are. Next slide, please. So I just kind of want to make sure that you have a little bit of basics about, what SOAR aims to do and how it operates. So SOAR trained providers are trained to be able to assist applicants with applying for 2 of SSA's programs: Supplemental Security Income, otherwise known as SSI, and Social Security Disability Insurance, known as SSDI. So while there are some similarities with these 2 programs, there are some key differences as well, which you see listed here on the chart. I won't go super in depth into, those key differences, but I just like to make sure that, you're aware that those are the 2 programs that applicants are being assisted with. Oftentimes we will get questions about whether, you just apply for one or the other or both. And the answer is SOAR trained providers are trained to assist with both. And the expectation is that they're helping to apply for both. Even if the person may not have a substantial work history, they could still possibly qualify under another's earning records. And there's also a requirement from SSA that if someone's getting SSI, they have to have applied for anything else they may have qualified for. So SOAR providers are trained to assist with both. And a person could be approved for one or the other or both or none. Next slide, please. So when we talk about SSI and SSDI eligibility, right? Because when we first started talking, you'll notice I really kind of emphasize there has to be a severe impairment related to their mental health functioning and physical health functioning and or a co-occurring disorder, right? And the reason I like to make sure I emphasize that is because SSA views disability differently than a lot of other systems that some of you may be used to, right? So for example, some of you probably have either heard of or may be familiar with the VA, how they look at disability. They look at it like they're willing to award disability on like a partial scale, right? So they might say you're 20% disabled, 40% disabled, whatever, right? Or there might be like a state short-term disability program, right? Where they're able to award disability for something short-term that's not permanent, right? SSA's definition of disability is completely different from that. With SSA, they look at disability as kind of an all or nothing thing. Like they look at it as you either meet our definition of disability or you don't. There is no partial in between, and they only look at what are considered permanent or chronic conditions. They do not consider anything that's like a temporary condition to be considered. They don't consider that in terms of disability. So when you look at SSA's full definition of disability, and I don't have it all completely listed there, there are kind of two main points there in terms of when you are working with an applicant to try to meet that definition of disability, right? There's medical condition and there's functional impairment. Now, I'm kind of curious from those of you here on the call, and you can put it in the chat box. If I was to ask you right now, what do you think the current approval rating is for someone who's putting in an application for disability? What do you think, like not specific to SOAR, just anything at all? What would you think is like the current approval rating? So I'm seeing a 40%, 15%, 10%, 20%. Man, the bar is low. The bar is in hell. Goodness. But you know what? You guys are sorry, Craig. But y'all have it right on point. Y'all have it on point. So generally speaking, the current, like for anybody who's putting in an application nationwide cumulatively, the current approval rating is about 30%. And believe it or not, that's actually gone up a little bit, like since past years. However, when you look at SSA's reporting tables and you filter for someone who A, is experiencing homelessness, and B, has a severe mental health condition, that number falls to about 17%. 17%. So think of all the people that you're working with every day, or your staff may be working with every day, right? Who probably have tried this process before and they're like, I've got denied and I just don't know what to do. They have a 17% chance of approval. 17. And oftentimes when you really kind of deep dive into their case, oftentimes for many of these people, it's not the reason for denial, it's not that they don't have severe impairments. They do. It's that the necessary information needed to demonstrate how severely it impacts their life was not present in that application. Many people, right? So when you're looking at this information on the screen here, many people with very good intentions, right? Because they don't have like deep training in how to do this. They just know that they have a client who's experiencing homelessness and needs to get income, right? And they're just trying to help them the best way that they can. Most people are going to focus on the left side of this chart only. They're only going to focus on medical conditions, right? They're only going to focus on, well, my client is diagnosed with schizophrenia. My client is diagnosed with epilepsy. My client is diagnosed with blase, 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 right? They have a diagnosis, they should qualify, right? But, and if there's anyone here in the recovery, comes from the recovery world like I do, we know simply having a diagnosis does not mean that somebody, like that by itself, does not mean that somebody can't work. You know, and at the basis of this application, that's what it is the person alleging they're not able to function enough to maintain work, right? Simply having a diagnosis by itself does not mean that a person cannot work, because I could be diagnosed with something and Craig could be diagnosed with something, and how we manage that and go about and live our daily lives, how our bodies react to it, can be completely different experiences. So that by itself does not necessarily render someone eligible. So for many applications, a lot of people are focused on just like getting information that shows that the person has a diagnosis. What is often left out is making the link to functional impairment. So making the link of, here's this person's condition, and these are the functional impairments that it causes. And so SOAR providers through SOAR training are taught to be able to gather evidence, gather information that helps to demonstrate not just their medical condition, but their functional impairment. And so I'll kind of give you an example of that, just because I'm kind of a visual learner, so I'm going to assume everybody else is here too. True story. So one time I was assisting two applicants, kind of around similar timeframes, right? Both diagnosed with epilepsy and experienced seizures, right? So if you're gathering medical information, you're gathering clinical records, if you're looking on paper, it's the same diagnosis. But person A experiences seizures maybe like once every 4 or 5 months. And I'm certainly not minimizing that. I'm sure it's very disruptive to their life, but experiences them maybe 4 or 5 times. But sorry, experiences them maybe once every 4 or 5 months. And really only experiences them like very severely when they're using, right? As opposed to person B, who experienced them almost every other day, had to have certain bed aids in his bed and had to have his mom or another family member like sit in his room overnight to make sure that he doesn't, like when he's having a seizure, that he's not falling out of bed, because whenever they're not in there and he has a seizure, he falls out of bed, like injures his face, has to go to the emergency room. Like, do you know what I mean? It was this constant thing. So while I'm certainly not minimizing anyone's experience, you can clearly see that with person B, right, there are certain factors that are demonstrating that this person experiences this diagnosis, or at least the impact of that diagnosis has a bit more severe impact on their functioning, their ability to live their daily lives. Okay, hopefully that makes sense. I don't want to ramble. I know there's a lot to talk about. So do you want to go to the next slide, Hope? Thank you. So as I stated, so SOAR providers are really kind of trained to be able to put together a complete application. So when you hear someone saying that they're putting in a SOAR claim, the paperwork, it's not different than your standard application. SOAR is referring to the way that they put that claim together. SOAR is the process. So the way they put it together and the things that they put in that claim. That is what makes a SOAR claim a SOAR claim. Okay. So I won't go like super in depth, but what you see listed here, these 5 things are what we call the SOAR critical components. Okay. So if there's an application that's being turned in as a SOAR claim, it's going to include, really it should include all, but it's going to include most of these components. And like, I'll just briefly state what they are. So the first is what's called a 1696 appointment representative form. And what that means is the SOAR provider is serving as that client's representative for that claim, only for the life of that claim, nothing beyond that. So which means that that provider is able to kind of serve as the bridge between that client and the SSA office, right? When you sit and you think about the clients that you work with every day and that you've served, right? And many of whom have probably tried their best to get through this benefits application process by themselves. I'm sure we could all sit here and talk all day about the many barriers that are going to get in the way of that. A, not having an address when Social Security primarily communicates by mail, you're doomed from the start. B, if there are cognitive issues, maybe not being able to remember or being a poor historian. The people at the SSA office not being social workers, so not necessarily always having the patience to really kind of delve into history. There's just all these kinds of things. So the SOAR provider is really kind of like that bridge between the person and the SSA office. The second is the collection and submission of appropriate medical records. So SOAR providers are taught how to use listings to be able to know, okay, well, if this is the disability the person's alleging, okay, these are the resources this is the information SSA and DDS need to be able to show that you meet that, right? So learning how to collect the appropriate medical records. The third is writing a medical summary report, which is not a clinical document, but it is a document where the SOAR provider is able to add on additional information that the DDS examiner might need to know about functioning, right? So going back to the example I gave about my client who had to have somebody sit in his room all night with them to help to stop him from falling and breaking his face, right? If you were reading a regular clinical doctor's note, right, it might note that he had seizures throughout the night, but it's not giving you that additional information, right, about how somebody has to sit in his room with them all night, right? Or if he had a stretch of time where he wasn't going to the hospital, that's the reason why. It's because somebody was there supporting him, right? So the medical summary report is where the SOAR providers are able to kind of add in that additional kind of supplemental information for functioning. The fourth is, if possible, getting a co-signature on that medical summary report from the person's treating provider. And the fifth is some type of quality review that could look differently depending where you are. And from tracking, applications that use all 5 of the critical components are significantly more likely to be approved. And I also want to note as well is that, again, I just want to kind of reemphasize the critical components is what makes a SOAR claim a SOAR claim. Sometimes you will have individuals who are SOAR trained and maybe assisting people, which is great. That's what we want regardless. But if they're not necessarily doing the critical components, it's not really necessarily a SOAR claim. Next slide, Hope. So what's listed right here are our SOAR outcomes. So these are national outcomes from all 50 states. So the chart on the right is our cumulative outcome. So this is like from tracking since 2005 till now, nationwide. So we are at a 65% initial approval rating on all SOAR assisted claims. So compare that 65% to that 17% that we talked about, or even that 30%. And the chart that you see on the left are our 2023 outcomes. So our outcome year runs from July 1st to August 30th. So these 2023 outcomes are from July 1st, 2022 till just recently, June 30th, 2023. And we were at a 66% approval rating for the year. And there were a total of 3,918 decisions. Yep, 66%, Jim. Yep, and a total of 2,604 approvals, which is great. Next slide. Oh. So I am going to keep myself in check because I could ramble all day and I know we don't have time. But one of the things that I really, really enjoy talking about is like, what are the benefits, right? Like, because really linking anyone to long-term income supports is really a win-win for anyone. What's listed here are some of the financial outcomes that you often see. Such as clinics, hospital settings being able to be reimbursed for Medicaid, which I think is especially important in a non-Medicaid expansion state like Texas. The average general assistance reimbursement rate, average retroactive back payments, things like that. Next slide. So I think too, like what's really important here is, when we think about the benefit for the individual, and of course, obviously, like having income, going from zero income to whatever it is, the amount that they're going to get, that's obviously a win for the individual, but it's really beyond as well. It's like it goes beyond just the monetary gains if you really think about it, because really the whole overall goal in being able to link someone to stable financial supports is really so that they have the stability to be able to just be a stable, productive member of our communities, right? Which we should all kind of have some like care or investment in, right? I know probably most likely everyone here is kind of involved in the housing world. And, the hope with that is that by having income, you'd be able to either obtain or maintain affordable housing. But even beyond that, there's increased education and employment opportunities, so opportunities for people to try out work if they want to and still keep their check. Just really this overall like quality of life. And I know I mentioned already, but I think it really bears mentioning that, for non-Medicaid expansion states, if someone's approved for, disability, they're automatically approved or they're automatically eligible, I should say, then for health insurance, which I think is just really, really key. I could kind of talk about that all day too, but I won't. So, just, keeping in mind like that, it's just next slide, Hope. I think as well as the individual, being mindful that states and communities benefit as well. So, obviously like linking someone to federal benefits, right? That's bringing federal dollars back into states, into localities, into community programs. And again, listed on those bullet points are just some of the ways that you see it most commonly manifested in. I think Hope or someone will probably present about that a little bit later, so I don't want to go too deep into it. But it's just really a win-win-win for everyone. Next slide. So the one thing that I do like to note about SOAR, so SOAR is, like I said, it's about putting together a complete application, right? And so with that, I never, ever, ever front about, you know what I mean, like the time that goes into that, because it doesn't necessarily have to be, but it can be like a very it can be time intensive. So individuals that are SOAR trained, there's a SOAR online course, and it's a comprehensive course that we estimate takes about 20 hours to complete. It's self-paced. It's not like there's a timer on it. But it's a comprehensive course. It's not one of those ones you can just put on online while you're like really doing something else. You're giving like a practice case person. You're actually filling out the forms like as if it was a SOAR, as if it was a real applicant, things like that. It's very comprehensive. Aside from that, we estimate that it takes between 20 to 40 hours like to work on a claim from start to finish to work on a claim. Don't let that scare you. We're not talking about 20 to 40 hours in a week. We're talking about over the course of 60 days. But where somebody might fall on that range, it's probably going to depend on the agency or whatnot that they're coming from. If you're from an environment where you have easy access to a lot of the critical components, such as let's say like a hospital or a jail, the clients are already there, you're not chasing them, you already have access to their medical records, you likely already have providers on site that you can get a signature for, right? Those type of places are going to be lower on the end because you have so many of the pieces right there. Whereas if you worked somewhere like I did, a mental health recovery center where I was walking around trying to find people under bridges, you're probably going to be on the higher end of that scale, closer to the 40 hours, right? Because so much of that time is really spent on engagement. So yes. Jim says, what's the general estimate per week on the high end in terms of hours, Jim? Yes, okay, I was gonna say, if you're talking about in terms of hours, probably like, let's say if it was one application, probably an average of like 2 to 4 hours a week. Next slide, Hope. So additionally, beyond SOAR online training, it's not one of those things where you're trained and we're just like, see ya, thanks. There's always going to be, here at the TA Center, we always aim to provide any kind of support that might be needed. So these are just some of the ways, so these are some of the examples listed here on the slide. We obviously mentioned the course, but we also have like a library, where we've got practice cases and sample MSRs and a frequently asked question section. We host some quarterly webinars. We've got an e-newsletter with tips and things like that. We do like a monthly soaring over lunch call, which is live. You could just join and ask your questions. We'll answer them. It's like rapid fire. And aside from that, me being your TA Center liaison, anyone can reach out to me at any time with any question, and it's never too small. It could literally be as simple as, I can't find this form, or I don't know what this question means. And I would be glad to, because my favorite interactions are just with the people on the ground. And I say that, I was trying to be quick in my intro, but I say that as somebody who, when I first got SOAR trained, like I said, I worked at a nonprofit mental health recovery center, was the only one there, just happened to get trained, got like approvals on like my first 4 or 5. So then after that, I was like, oh, you're the SOAR person, right? So I think like the point of me saying that is kind of like, I feel like, a lot of like providers and agencies that experience barriers with SOAR. I definitely share a lot of those experiences. And so I come to this work and I come to these conversations always being informed by those things and using all of those barriers and negative experiences that came along with it to help make sure that they are positive for other people. So, I don't sit here saying this and preaching to you like from this kind of like ivory tower over at SAMHSA, but I come to you like from someone who literally has that experience on the ground. Next slide, Hope. So SOAR does not exist in a vacuum. It can only really be made successful by different community collaborations. And there are just a lot of pieces here that come into play to help make it successful, aside from housing providers such as yourself, but clinics, hospitals, schools, veterans organizations, criminal justice serving organizations that, there's just a lot of collaborations that need to happen, or not need to happen, but if, make this process a lot easier. And I believe on the next slide, I'm turning it over to my colleague, Lila, to share a little bit. And Lila, if you're talking, you're on mute.
Hi, good afternoon. Thank you, Samitra. I'm sorry, it was cutting in and out for me a little bit, my Wi-Fi. So yeah, let me see, what can I say? Samitra is awesome. She's covered a lot. So I just wanted to share a little bit about SOAR in practice here in Houston, and not only as a community, but also just within the organizations that I have worked. I have worked over at a larger organization, which now has a team of 8, which I'm really proud of. But anyhow, so that's one of our successes there. So successes overall, what does that look like? And again, I'm keeping in mind that we're talking about smaller areas. But here in Houston, we did start off with one agency, which was producing Social Security disability applications, but not utilizing the SOAR model. And I'm sorry if there's an echo in the background. So basically how we grew, and I won't go too much into it, but basically we started with the one agency, and we tapped into connecting with the local Social Security office, who we were zip code assigned. A lot of these agencies, a lot of the Social Security offices, they utilize the agency zip code or the client zip code to go ahead and process that application and so forth. So I'm just putting that out there. So when y'all begin doing applications, you might want to look into that as far as which office you're zoned to or the client is zoned to. So getting back to successes. So we started off with connecting with our local Social Security office, connecting with their manager, and then making that first connection. So then what we did was we evolved into utilizing the SOAR process by making sure that all of the staff, myself included, was trained with through the SOAR website. And actually at that time, it was a few of us got trained down the road on the SOAR website, but I was actually trained in person. They used to have the stepping stones. So that was actually done in person. And so once I was trained, I was able to become, after a few months, a SOAR coordinator. And this is all just kind of like, I'm just kind of telling you like the what it looked like, right? So from the beginning. And so then we ended up adding a few people to the team in which they were either trained in the old training 2-day in person, or later on they were trained on the wonderful SOAR TA on their website on SOAR Works, on their adult training for SOAR. And so adult applications. And so fast forwarding, we just tapped into SOAR TA with all their support. At that time, we were working with Kristen Lufer. So yeah, and so she helped us get off the ground. And so we went from producing maybe 1 or 2 applications a month. And then we bought on more staff, like I was saying, and we ended up producing, it was about 8 to 10 applications a month. So it's, so I say that loosely, again, like Sumitra said, it's in the beginning, you just want to kind of get the training going and so forth. But we were able to produce really quickly, sort of thing. So then after that, we were able to connect with clients, connect with healthcare. We made all those initial connections. And so those were a lot of successes, especially connecting with the manager over at a local Social Security office. And so I don't want to sound overwhelming here, y'all. So, that's what the picture looked like for me in my experience. Can y'all still hear me?
Yeah, we can hear you. A couple of people lost sight of the slides, so we're just making sure.
Okay.
Audra
Okay.
and Nancy, y'all seen the slides now?
She says still not.
Exit out and come back in. Let's take a second. We'll take a break. Just if you can't see the slides, exit out and come back in. We'll stop. We'll pause for a second.
Do you think it's on my end? I didn't change anything.
No, I was seeing it on my end.
No, I can see the slides, Hope.
Okay,
There might be some just local connectivity issues.
Yeah.
gotcha.
Okay.
Thanks,
Yeah.
Luis.
So Luis is seeing them, and then let's see if I can chat them directly. Not yet. Thank you, Tina. Just waiting for them to pop back in. Daniel can see. Okay, perfect. All right. I'm just waiting for Audrey to get back in here. Well,
Hey, so let's keep going.
yeah. Well, you can, Lila, you can start again. I'll keep an eye on things.
Okay.
Okay, thank you. So yeah, so as I was saying, just talking a little bit about what the build out looked like for us. And again, I'm talking about, Houston, but breaking it down to like a single agency that basically sparked SOAR in our community. And so so once we were able to make those connections, we celebrated those successes. And we were celebrating right along with the clients because we were able to initially really make that strong connection with the SSA office, who really took us under their wing and taught us what are the expectations, on both sides. And so we were able to really collaborate and make a successful connection there. So I won't minimize on the fact that did take about a year to build out, and to where we all felt really comfortable with, what is SOAR? Like, what's the ultimate goal? Obviously, of getting the disability benefits, But there are also other goals that we succeeded at with connecting individuals to healthcare. So it's not always about, well, it is. The goal is to try to help them get there, attain those disability benefits, right? But sometimes it just doesn't pan out. So I want to remain realistic. And so, but there's also successes within that. What does that look like? Connecting them to healthcare. So these are individuals who maybe throughout the many years, they haven't been to a doctor's office or a doctor in, it could be 10 years for some of them, right? And so reconnecting with healthcare, we celebrated those connections as well. Maybe we're not celebrating the money part, right? Receiving the benefits, but a lot of our clients are able to reconnect and get their health back in line, right? So, or we connected them with employment programs if that was a route that they wanted to go. There's just a lot of connections that can be made, even if the benefits don't come through. So I wanted to put that out there as a success as well. So you want to celebrate all these little successes along the way. So challenges, I'm going to move on to challenges. So the challenges we did face were, I would say, initially trying to connect with the Social Security office, right? So like I said, that was a build out. And so, but just making that first attempt at connecting with their one office and their, they have a lot of different managers, different levels and such, but their main manager of that office. And, just going in there, having a good conversation, that kind of thing. We did get, so she worked with us well, but we did have the challenge of having someone who would process our SOAR applications. Like that was part of their job. We wanted to make sure our clients' needs were being met as far as, there's a timeline. We're trying to get these expedited. And so we did have challenges around that in the fact that our client applications were some of them were being routed and processed as non-SOAR applications. And so just to be realistic, that is something to keep an eye out for when connecting with your Social Security offices, that you want to make sure that these applications are being treated and processed as SOAR applications, and that the timeliness, is a high priority. So, and we also, I would say some of the other challenges, or one other one, is when they were processed at the local office, but because these offices don't treat any or don't process applications with medical needs, the disability ones, so those are routed over to Austin to disability determination services. And with them, we had to establish a connection there as well. The Social Security office, if you happen to get lucky and there's someone there who is willing to, give you a step in that direction, or maybe has a contact at DDS in Austin, then that's fabulous. But if you're not, I would say, there was the, I live about 4 hours, in Houston from Austin. So I wish I could kind of drive around, and make those connections. But so I did a lot of phone work, and so a lot of my legwork through the phone and just connecting to the unit, the SOAR unit, the unit 22 in Austin at DDS is the unit that processes these SOAR applications. And I'm sorry, I don't mean to be so lengthy, but I just get talking about SOAR and I just think of so much. So it took us a while. I would say it took us, I think we secured a connection there with their manager over that unit. And that took about 6 to 7 months, I would say. And to really secure that relationship. And then from there, just through many years, I moved on to a different agency, but starting out, and I'm still with the other agency I went to start their SOAR program. So, but so once we were able to connect with the unit manager, then over time, we're able to connect with their director, their deputy director. And these are all names or, individuals who I will make sure that you have those contacts as things evolve for y'all. So those were initial challenges because those are the key people you need on your side. with your agencies to really expedite these applications. And really, they have the one-on-one communication with the unit and with each of these examiners that is receiving your applications or will receive your applications. So yeah, so that's how that went, the part with, a little more about Social Security and then DDS. Some of the other challenges are around with clients. So as far as communication, being able to, as we know with our population real quick, sometimes they don't have phones. Sometimes they lose the phone, what have you, right? And so we really work closely with their housing case managers. We really work closely with peer support specialists. We work closely with just even family members. Just really trying to keep that connection there. We hit the streets when we have to and get out there and look for them if we have to with outreach teams. So that was where a lot of the challenges were as well. But yeah, so getting to know your community really well. I know a lot of communities are very small throughout Texas, in the more rural areas, but really being able to distinguish, okay, what part of town do you tend to stay in if they're chronically homeless? If they're not, then really maybe even tapping into the apartment office manager. These are just some things that I ran into. So yeah, because those can be challenges with our population. So it's all about getting to know your community really well and tying in, getting to know the areas that a lot of our clients stay in, and trying to walk through those challenges and really just make those contacts out there. There's even clients who help us find other clients. And so just putting that out there. Then lessons learned and advice. So a lot of lessons I gave that I went through and just a lot of learning. I would say that as far as advice, again, just to remind y'all, it took me and the team that I was working with about a year to really, really feel comfortable in the ties with the community. Just putting out there, just talking about SOAR as much as I could, and how great this program is, and the population we work with, and getting those referrals, and just really establishing oneself in the community, and tying into SSA, tying into DDS through maybe an SSA rep, and so forth. Again, I'm happy to share a lot of this information, a lot of the contacts once y'all get going, because that's how you can really find success for the clients, for yourself and for the clients. And they are really powerful resources that when there are challenges with cases, and I know I can just tell y'all, sometimes I was like, sorry for the background noise. Sometimes I was like, okay, I haven't run into this challenge before. How do I make this happen for this client? Maybe it was a client who had some immigration issues or challenges. Maybe it was an SSA rep who really wasn't working well, like trying to get things done, right? For lack of better words. And so, so a lot of these relationships were really able to say, okay, Lila, this is who does this at the Social Security office. And so let's go ahead, connect with them. Or this is the person in Austin you want to who can help you through that challenge there. So I would say those relationships, just like in any, in social services overall, in any business, are able to make those contacts, keep those contacts. And a lot of Social Security, and I'm wrapping up here, but a lot of Social Security representatives and even at DDS, they tend to stick around. They're there, some of them till retirement, which is great because you will need them. And I'm 9 years out and I have one contact. Again, I don't know if I mentioned this earlier, but we've worked together for the last 8 years. And he is one of those individuals who plans to retire from Social Security Administration. And so it's been great because we've been able to formulate that tie there. And to this day, now it's like I just email him or call and he's like, here you go. Here's the information. This is what's going on with the case in Austin. This is this is the examiner's name or contact. So I know I said a lot, y'all, and I love talking all things SOAR. So please excuse me for being so lengthy, but I just really wanted to give y'all an idea of, a picture of what the challenges, successes, and some of the advice out there. So thank you.
Great, thanks, Lila. So in closing up, so as you kind of go forward and continue, and I'm sure you'll kind of have these discussions and whatnot amongst yourself, your agencies, or together. But we just kind of encourage you to just reflect and ask yourself, how does your agency currently assist zero-income clients? Because you are somehow in some way, right? Like someone in your agency with good intentions is attempting to do that. How does your agency currently do that? And how is that process currently working for you? And we encourage you to consider if SOAR can help improve that process, whether it's helping to improve the outcomes that you do get or the number of applications that you can do. But we just genuinely encourage you to kind of really reflect and think about it. Next slide, Hope. And if you would like more information about SOAR or want to stay up to date on like our SOAR news or our events or our webinars or our national facing type things, you can feel free to click that QR code there and add your name to the listserv. And with that, that's the end of my presentation. I know there are some other sections y'all need to get through, but if you want me to take questions for a couple minutes, I'd be glad to do so if there are
we
any.
want to pause here for just a minute for questions before we transition, in case anyone has any burning questions they don't want to forget. But we will also have space at the end for Q&A. I don't see anyone typing. If we do, Craig, I don't know if there's any questions in the Q&A pod.
Nothing in the pod yet. Also,
Okay.
I mean, if y'all are worried, you can submit anonymously. There's no bad questions here.
Good looking out, Craig. Well, again, we will have some more time at the end for questions, so we will go ahead and walk through the rest of the slides. Thanks so much, Sumitra and Lila, for that wonderful information. So transitioning a little bit away from what is SOAR to why is SOAR important for the balance of state. So SOAR has been a longstanding priority for the balance of state continuum of care. And as a COC, we have really doubled down on our commitment to SOAR in 2022, specifically following HUD's release of the FY 2022 COC supplemental NOFO to address unsheltered and rural homelessness, commonly referred to as the SNOFO. So the SNOFO required COCs to develop COC-wide plans to serve individuals and families experiencing homelessness with severe service needs, and then further required project applications of the SNOFO to develop applications that align with the COC's plan. And this plan was developed collaboratively last summer with stakeholders throughout the balance of state through a number of feedback and input sessions and survey opportunities. So the final plan that we have put forward really represents the priorities of both the COC and the stakeholders and providers and clients that we serve, and that who contributed to the plan. So while the plan was only a requirement for a specific funding opportunity, as a COC, we are continuing to use the COC plan to guide other funding opportunities. So starting in the FY 2023 COC program competition cycle, which just wrapped up in September, all project applicants under the COC program competition, beginning in that cycle and moving forward, must demonstrate alignment with and work to advance at least one or more priorities identified in the COC plan, which I'll be covering here on the next slide. And this requirement will also likely apply to non-COC program funding opportunities that require a letter of support from the COC as a funding application requirement. Oftentimes it's the requirement of like SSBF grantees or other grantees through the Veterans Admission, but also administration, but also a number of other funding opportunities. So any grant applicants requesting a letter of support from the COC as a requirement of a funding application will likely be asked to provide a brief explanation as to how their proposed project advances the priorities of the COC. So keep that context in mind as I go through what our priorities are as the COC, and then I'll talk briefly about HUD's priorities. So with that context, here's an abbreviated list of our priorities for the balance of state. The bullet points on these slides represent a brief overview of our priorities. However, this text in green, which looks like Axon just dropped in the chat, links to a more comprehensive document that talks about each of our priorities more in depth, as well as HUD's priorities for funding. So obviously there's only one specific item on this list that explicitly calls out SOAR. That said, if you are effectively using SOAR in your community, that work will support and advance several of the other priorities listed here, which I will speak to. So taking a closer look at bullet point number 4, pretty straightforward. The purpose of this priority is to employ staff whose primary function is to assist individuals with their SSI or SSDI applications through the SOAR process, whether that's through the funding that you're requesting as part of your program application or through another resource that already exists in your agency or in your community. And this is a priority for the balance of state because connection to income and mainstream resources is a crucial aspect of fostering long-term housing stability for many of the clients that are served in a given housing program. And many grant-funded programs not only expect that you're working with households to increase their income and connect them to mainstream benefits, but also expect or require that you're collaborating with other partners in your community and leveraging other available resources. And as Sumitra kind of mentioned earlier, SOAR is a really great tool that can be used to build those relationships in your community when collaborating with medical providers and legal providers and a range of other providers in your community to process a SOAR claim. Which can help foster a community-wide commitment, which, as you can see, is another one of our priorities. So through the SOAR process, providers will develop working relationship with other providers in their communities, such as the local Social Security office and local medical or treatment team providers. And again, these can help not only foster community-wide commitment, but also help in leveraging other resources as part of your program that you are putting forward, which is often not only a requirement for us as a COC, but also often a requirement of many other funding sources as well. Further, if you're using SOAR or plan to use SOAR, you probably also have a method for prioritizing what clients will be served first through SOAR, or hopefully you have a prioritization method for determining who you're serving or referring to SOAR. And oftentimes this mirrors or can mirror your community's coordinated entry prioritization standards. So if you have a method or plan to have a method for prioritizing referrals for SOAR, then it's likely that those prioritization standards are targeting the folks with the greatest need, including the folks who are hardest to serve and underserved communities, which advances 2 of our other priorities that we've identified for the balance of state COC. So continuing to talk about homelessness priorities, HUD has also identified a number of policy priorities that guides their work and requirements for funding that they put out. So while none of these priorities explicitly state use of SOAR, there's definitely an overlap between these priorities and implementing SOAR in your programs or your community. For example, one of HUD's priorities is improving system performance, and there are income-related system performance measures, which I'll be speaking to more on the next slide, that could be improved or achieved through implementing SOAR in your programs. Additionally, leveraging partnerships with other providers is a priority of HUD. And like I mentioned previously, SOAR does require collaboration with other entities in your community through working with your local SSA office or local treatment providers or other referral sources. And establishing or strengthening a SOAR program can be a mechanism for leveraging relationships in your community to better serve your target population. So taking a closer look at SOAR and its relation to system performance measures and other grant reporting outcomes. I know system performance is everyone's favorite topic, but SOAR can definitely be used as a strategy to increase clients' income, which results in stronger outcomes, specifically for SPM or System Performance Measure 4, which evaluates employment, income, and growth. And then the specific metrics within SPM4 that relate to SOAR are 4.2, 4.5, and 4.6, which are all related to non-employment cash income for adult stayers and leavers, and then change in total income for leavers. There are other metrics that aren't directly related to SOAR that are captured in system performance measures, but that using SOAR could impact. For example, Sumitra, spoke to earlier about how SOAR can increasing clients' income is the first step in achieving housing stability. So if you have a high number of folks who are increasing their income, they're more likely to achieve housing stability, and you're more likely to have better housing retention outcomes, which is another system performance measure that we look at as a COC as well as HUD. Additionally, if you have a COC funded or ESG funded program, your annual or quarterly reports that you submit to your funder provide a summary of income growth for clients served, in addition to a percentage of clients who have increased their income within that reporting range. And if you are a COC program funded grantee in the balance of state, that income growth is something that we look at closely and evaluate all projects on their ability to increase income for participants, both quarterly and annually through our funding competition. Obviously, this is not a comprehensive list of all programs within the balance of state that assess clients on income growth within their programs, and there are many others like the SSVF program, which is funded through the VA. So if you are still not convinced how SOAR can be used as a strategy to achieve and improve housing-focused program outcome metrics and performance, I wanted to leave you with some final considerations before we open it up for Q&A. So I've talked at length already about how using SOAR to increase client income and overall can be used to increase client income and overall performance. But something I wanted to cover here is a common misconception that I hear frequently from providers, which is that their program can't achieve income growth performance metrics because the majority of their clients are receiving SSI or SSDI as their primary or sole income source. And this is actually not quite true. Folks receiving SSI or SSDI do receive an annual increase to their monthly payment through a cost of living adjustment. Generally, it's a pretty minimal increase, but it still very much counts as an overall increase in their income. So if the majority of your clients are receiving SSI or SSDI, you should actually have pretty strong outcomes as it relates to income growth. So here is your reminder that the only way to get credit for client income growth in HMIS, at least for the COC program, is to complete your annual assessments in HMIS for your clients. So moving on to connection to mainstream resources. I spoke to this briefly earlier, but building local working relationships with a range of providers and building community collaboration are all principles that are often requirements of funding. And implementing a SOAR initiative in your program or your agency is definitely a platform to achieve those requirements and those outcomes. I spoke to this briefly earlier, but increased housing stability and retention, very simply put, connecting clients to income and mainstream resources increases the likelihood that they can achieve housing stability and retain their housing, which again, housing retention is something that we evaluate our funded projects on both quarterly and annually. And I know many other funders do as well. Reduced rental subsidy or supportive services cost. So many programs like the COC program require that you cannot make a client contribute to the rental payment if they have no income. But by successfully connecting clients to income through the SOAR process and the SOAR model, this reduces the rental subsidy that your program pays on behalf of that client because they now have income coming in and they're now paying a portion of their rent, which then frees up your money for your agency to serve a greater number of clients or offer additional supportive services to the clients already served because you have more grant money to do so. And lastly, increased trust with clients served. Obviously, there's not any HMIS data element or report that you can run to evaluate trust or rapport with clients, but increased trust with clients translates to a better working relationship with your clients, better engagement, and an increased likelihood that those clients will work with you towards achieving their other housing stability and service goals, and will have overall stronger outcomes as a result of being in your program. And what better way to develop trust and rapport with the client than by walking alongside them and helping them navigate what can be a really overwhelming system for someone to go through alone, and being a champion for them and their income growth. As I was developing this slide, I was thinking back on all of my years in direct service and how many unintentionally bad referrals I've made on behalf of clients for benefits assistance, and just wish that there had been a reliable resource like SOAR in my community that I could have connected them to. And I'm sure that many of the providers on this call can relate to that feeling. So I would challenge each of you to strongly consider how you can incorporate SOAR into your work. If that is something that you're interested in and you're not sure where to get started, I'm happy to have a conversation with you. I can drop my email in the chat, but it's also linked later in this presentation. And with that, I will open up for Q&A. Thanks, Craig.
And if y'all want to come off mic, just raise your hand and I'll unmute you and you can just ask your question out loud. That's easier. I'm not seeing any.
Yeah, I know we gave y'all a ton of information, so it's totally fair if you are still processing all the information that we gave you. If you think of questions later, you are welcome to reach out to me. And I believe, yeah, I see someone still kind of processing. It's a ton of information, a lot to think through. Probably may not even know what your questions are yet. But I believe there is plenty of contact information and resources listed in this slide if you have questions later. Well, I don't see any questions coming through. So I think we can give everyone a little bit of time back in their day. I just want to give a huge thank you to Sumitra and Lila for a wonderful presentation. Again, if folks have questions, please reach out. We want to support you through this process. We know that there is a huge need for SOAR in the balance of state and not enough folks who are doing the work yet. But we know that, but we're here to support you in your journey.
All right, and we will send out the materials as soon as we can.